Hey, good day. It's Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, McCain. Well, I'm not even going to apologize for my cruddy name, but hey, listen, hopefully you find some value into what I'm talking about. There's actually quite a bit of research goes into it. I don't just sit here and spout off at the mouth on just about nothing. All right, let's go over headaches. And I know I've kind of beat to death headaches, but I get people walking in my office. A girl just came yesterday. She had headaches for 10 years. Life is miserable. Pain. She doesn't because when you get bad headaches, you do not sleep well. What happens is your nervous system is on overload, so you don't get a deep, restful sleep. Even if you take a pain like a nighttime sleep aid or pain reliever, you're not going to get the good rest. It's really impossible. So to that end, here's what happens: is you have pressure on the base of your brain, the AKA brainstem. Like, right below the base of your skull is the brainstem. There's three important parts of the brainstem. And I know anatomy is probably not your thing, but if you get an understanding first of the anatomy, it may make sense as to why a lot of headaches occur because of subluxations, mislocations of the vertebra in the base of the brainstem. Okay? So the brainstem is a critical part of the central nervous system. At the base of your brain, three main components. The medulla oblongata. Was it a song with the police? I don't know. Zenyatta Mandata. That was a song the police did. But anyhow, it's not to be confused with the medulla oblongata. It's the lowest level of the brainstem, is responsible for controlling vital functions such as heartbeat, breathing, blood pressure, and reflexes like swallowing and vomiting. Pretty important, all of them. I guess if you had to pick two, I mean, swallowing and vomiting are important, but I mean, heartbeat, breathing, blood pressure, certain reflexes, like a gag reflex, those are important, okay? And when you have headaches, it's changing your blood pressure as well. Okay, so that's the medulla. That's the lowest part. That's kind of like be the fifth and fourth fingers if you count all five fingers as being the brainstem. The pons is located just above the medulla, and it's a bridge that kind of connects different parts of the brain. So it plays a role in functions like facial movement, sensory information transfer, and certain aspects of sleep and respiration. So, facial movement, a lot of times people can have headaches where they have eye pain or pain in the face itself. Um, some of the cranial nerves that go into that is several, but as far as there's 12 cranial nerves, and I'm not going to go into 12 cranial nerves today, but can you see how the pons is part of the brainstem and how functions like facial movement, sensory information transfer, and certain parts of sleep and respiration. Pretty important. I mean, so basically, try to think this. This is the part of your brain that's outside the skull. All right, the midbrain. A lot of things in anatomy have two or three different names, and why they do this, I don't know. It was a pain in the butt to study it, but here we have the midbrain, also known as the mesencephalon. Old part of your brain, like when the embryos first gets developing. So, and that's positioned above the pons. So you have the medulla oblongata on the bottom, pons in the middle, midbrain, mesencephalon on the top, and then you're in the brain. Okay, and it's involved in sensory and motor functions. So it's a relay system for visual and auditory information and plays a role controlling eye movement. Now, how many times people have visual disturbances when they have headaches? A lot. Auditory, it's too loud. Visual, you see the auras. So there's more than just a tie-in here. And what happens is, so these three components, the medulla oblongata, the pons, and the midbrain, which make up the midbrain, they regulate many involuntary bodily functions, and they connect the brain to the spinal cord. It's not the spinal cord, it's the brainstem. And it's a conduit for signals traveling between the brain and the rest of the body, ensuring a nice, comfortable life. But here, so what happens? How do you get irritation on the brainstem? Irritation along the brainstem can cause headaches, and quite honestly, I think a lot more often than you would realize. Um, Being part of the central nervous system, regulating certain parts of bodily functions, pain perception and sensation of headaches is a pain perception. So let's go over the different pathways. Okay, the pain pathways. The brain contains several nuclei and pathways that are involved in processing and transmitting pain signals. When there's irritation or dysfunction, say a bone out of place, putting pressure onto the brainstem, and that's what happens. And there is no medication out there that's going to stop the pinching or the problem that goes along with pressure on the brainstem. It just doesn't work. Okay, there's no medication that I see, and that's why if you ask a doctor, most doctors no, we don't really know what causes headaches. We think these receptors are causing headaches, but we have this pill. We can do shots, we can do Botox. You'd be surprised at just taking the pressure off for the chiropractic adjustment, what it's going to do for headaches. It's probably one of the easiest things, the most fun thing for me to fix as a chiropractor. All right, so when you have dysfunction in the region, it can affect the way the pain signals are processed. Pain is a signal. How they're processed is important. Less interference, better processing of signals, less pain. So another thing too is the brain stem has control over blood vessels in the head, including the scalp and the meninges. The meninges are the protective covering surrounding the brain, pia mater, dura mater, and arachnoid space. And irritation of the brainstem can lead to changes in blood flow to these vessels, which contribute to headaches in big time. But also, too, is I'm going to divulge a little bit, not divulge, go off track a little bit. What happens is the blood flow when you have tension or influence on blood flow in the scalp. And again, the meninges. If you have heard of meningitis, it's inflammation of the meninges. So that should bring it home that it's a system that wraps around the brain and the spinal cord itself. It's three levels. We went over that: pia, arachnoid, and the dura mater. Those are the three levels. But in between each level, you have nerves, and there's contractions at the brainstem that's going to alter the pain perception. So sometimes people think they're going to have more pain because there's more. This just the way it rolls. Okay, there's more pain perception. It's dysregulated pain perception. So what happens is you're going to feel pain signals quite often more than you may otherwise. So that's one of the problems when you alter that. All right, so brainstem controls and regulates certain muscle tone tension in the neck and the head. Irritation in this area of the brainstem can increase muscle tension, particularly in the neck and shoulder. How often does somebody say, "Yeah, my shoulders are tight. I can't feel my neck. Every time I get a headache, I get these stress headaches, tension type of headaches." Well, the brainstem is a place to be looking. Now, you can go get. And here's an interesting thing: is a lot of times people get MRIs, and the MRIs don't show anything. You're not going to show tension and contraction. They're not going to recognize what us chiropractors call a subluxation to determine if you have a subluxation, putting pressure there. So it's a moot point. The doctors say, most doctors say, well, don't go to the chiropractor. So in this case here, would you rather live with headaches or spend thousands of dollars a month on Botox? That's up to you, but this is a pretty simple pathway out. So the altered pain perception is one thing. Now you have dysfunction of pain regulation senses because again, the space between the meninges, what we said before, the blood vessels contract within the different levels of the pia, arachnoid, and the dura mater, and all those spaces, those three coverings on the brain, you have a lot of nerves, and what happens is you're going to get dysfunction in those regulation systems because there's going to be tension onto those things. So the more tight it is. Hey, listen, you put a shirt on that doesn't fit, it's going to be tight. All right. So the brainstem houses centers that regulate pain and sensory information. If they're not functioning properly due to irritation or subluxation, it can result in a perception of pain, including headaches. So I think what you got to do is just open up your mind because first of all, you're not going to learn about this on TV. Advil wants you taking Advil, Aleve wants you taking Aleve, and Tylenol wants you taking Tylenol. And listen, if it gets you through the day, that's one thing. If you're not sleeping properly and you still have headaches, but you still got to take the medication, but you don't know what to do, call your local chiropractor up. Not everybody who goes to my podcast is in Darien, Connecticut. But the fact is, chiropractors can help a lot of headaches, an awful lot of headaches. And it's my favorite things to treat a headaches because, one, it's kind of easy. I mean, for me, it's pretty simple. I mean, we use a little bit of laser, we use some shock wave on the shoulder muscles, massage. So, you know, understand headaches can be caused by irritation of the brainstem, and they can vary in type and severity. So you get migraines, tension, sinus, all those other. A headache's a headache. But you would be surprised, especially if you're suffering from headaches, how much better your life can be when you say goodbye to headaches. All right? No one loves headaches. I don't love headaches. You don't love headaches. No one needs headaches. All right? I'm Dr. Brian McKay, not just a chiropractor. Stanford, Darien, Norwalk, New Canaan. I thank you for listening. Hopefully, you've learned something valuable as far as the causation of headaches. Need to reach out to me 203 656 3636. 203 656 3636. Have a great day.